Namaskar. My greetings to both Dr. Sunita Tandulwadkar, Fogsi President, and our guest, Dr. Vivek Virendra Singh. A very good evening to one and all, and I would like to extend heartiest welcome to the esteemed audience of Gyan Pravah, the podcast series. Welcome to episode 64th, hosted by the Clinical Research Committee Fogsi under the dynamic and visionary leadership of Dr. Sunita Tandulwadkar, President Fogsi 2025. ज्ञान का बहता रोजाना एक नया अनोखा रंग हर रात 8 बजे जुड़िए फॉक्सी के संग. I am Professor Dr. Surekha Taire, Chairperson of the Clinical Research Committee of Fogsi and your host for today. It is my privilege to welcome our distinguished guest, Dr. Vivek Virendra Singh, Chief of Health at UNICEF India Country Office. Today's discussion is on a very important topic, transforming women's health through collaborative action. Welcome, Dr. Singh. I would also like to welcome our very own President, Fogsi, Dr. Sunita Tandulwadkar, an iron will lady, a visionary, and a force of innovation. Dr. Sunita Tandulwadkar doesn't just lead, she inspires and transforms. With every initiative she takes, she uplifts those around her, empowering them to become leaders in their own right. Her revolutionary Gyan Pravah series, which is a daily podcast, has completed 64 episodes and has turned 30 committee chairs into confident voices, each shaping the future of gynecology. Her various project, her Eagle project, it is a groundbreaking initiative training gynecologists in endoscopy. आरोग्य योग यात्रा, 2 टिके जिंदगी के, संपूर्णा, निर्मल बनारस. These are her other trailblazing projects set to revolutionize women's health in the nation. Dr. Tandulwadkar leads by example. Globally acclaimed IVF specialist and endoscopic surgeon, she has redefined infertility treatment in India and pioneered advancements that once seemed impossible, whether delivering India's first stem cell baby or steering Fogsi into an era of inclusivity, mentorship, and cutting-edge science. Her leadership is not about holding power. It is about creating power in others. As she often says, leadership is not about control. It is about empowering others to rise and lead alongside you. Madam, we are honored to have you. May I request you to deliver the welcome address?
Thank you, Surekha. Thank you for such a lovely word of yours. Vivek sir, welcome to our podcast series. This is a wonderful initiative. Actually, I never thought that time that it will evolve as a person, me also. I just had in my mind that the committee chairpersons, they remain little clueless what they are supposed to do, from where they are supposed to get the funds, and just the CMEs or webinars. And that's what I thought. They all are amazing people. They are our future leaders of Fogsi. They have a huge talent. Let's give them a platform where they can have their spatial dialogue, one series per month. And they can call anyone from academic, non-academic, like you, policymaker, or the helping hand. So believe me, I am enjoying every evening because the faculty which come, they are such a highly accomplished that you get something new to learn from each and every one of them. It's such a varied topics we cover, and I'm amazed the way our chairpersons are working. About Surekha, Surekha is a fantastic worker. She's a very passionate, devoted. You give her a work and then you have to forget because you know that it is completed. And that quality of yours, Surekha, apart from your academics, apart from your anything else, this hard work and a passion will take you long ahead in Fogsi and in your personal life also. Sir, UNICEF is working very closely with Fogsi for years together. Preconception area, now I'm working very closely with another sector. I do understand UNICEF has many sections, but they work so beautifully. And I'm so happy that as of now, I don't know about the future, but I don't see the American government has affected UNICEF as of now. To my level, it has not reached. As long as the leaders are not affecting the other organization leaders, I don't have to say anything. But I'm so happy, sir, that Surekha got you and will bring out a different part of life. So thank you for being on a Foxy platform, and we'll catch up with you personally sometimes.
It's my pleasure, Dr. Sunita and Professor Surekha, ma'am, who's leading this initiative. And under your leadership, such and many other initiatives, as you mentioned, we are partnering as UNICEF with Foxy. They are definitely groundbreaking. And regardless of the geopolitical situation because of one country or the other, I think the mandate of UNICEF will always remain, and that is to ensure that all the states, which is the countries across the globe, they ensure that the rights to the children are enshrined and they are provided by the countries, and mothers play a very central role. Mother's own health plays a very central role in children's rights. And I congratulate you for conceptualizing this series. And as you mentioned, that all 4 stakeholder groups are contributing to the CME, which is so very important for the Foxy fraternity. So congratulations to you and to Dr. Surekha for this initiative.
Thank you. Thank you, madam, for your inclusiveness, for holding our hands and taking us together. And thank you, sir, for joining. This is the second of every month that Clinical Research Committee is coming. And every day we have different committee chairs who are hosting very, very beautiful and honorable speakers. So let me introduce to you Dr. Vivek Virendra Singh. Dr. Vivek Virendra Singh is a force to reckon with. He is a public health leader with over 2 decades of global experience in public health. Dr. Vivek Virendra Singh is a dynamic professional with expertise in public health program planning, implementation and evaluation, action research, academics, and consulting. He has worked extensively with state health departments, UN agencies, and leading academic and research institutions. Currently serving as the Chief of Health at UNICEF India Country Office, Dr. Singh manages newborn survival and development programs, drives cross-sectoral policy and health system interventions, and provides leadership to UNICEF health initiatives in India. His tenure at UNICEF also includes leading child health programs in Odisha and contributing to India's polio eradication efforts. Dr. Singh's academic credentials include being an adjunct faculty at Emory University and serving as associate professor at the Indian Institute of Public Health, Hyderabad, where he mentored future public health leaders and conducted research in health systems, strengthening and implementation science. He has also contributed as a consultant to global organizations including WHO, UNDP, and CDC, and has played a key role in disease surveillance, immunization, and health system evaluation across multiple countries. He has also served as the regional editor for India for The Lancet for 3 years, 2014 to 2016. Sir, it is a great honor to have you with us on this forum with a very, very important discussion forum. Thank you so very much. Welcome, sir.
It's my pleasure.
Thank you, sir. Now, as the protocol says, you and Surekha will be having the dialogue, and I will join from another link. Thank you.
So let's begin this discourse with Dr. Vivek. Dr. Vivek, can you highlight and enlighten us the current status of women's health globally, and what are the key challenges and disparities therein?
Greetings again, Dr. Surekha. See, we all know that globally the life expectancy, both for women and men, is rising. But let's take the maternal mortality indicator as a marker. In 2020, till the time when data is available, every 2 minutes a woman would die, and about 800 women. Globally, since then, in the last 2 decades, the decline has been to the tune of 30 plus percentage. But in India, where most of the women now live, the decline has been twofold and more. So about 64% decline in the same period when the global decline was 30%. So the status of women's health is definitely improving, but there are new and emerging challenges. In fact, India has done remarkably well in terms of decline in maternal mortality, which will also be seen in the upcoming release of the maternal mortality estimates. But we do have a lot of emerging challenges for women's health, and that is global, but we also have a country context of these challenges.
Sure, that a lot of challenges do exist, especially in a country like India, with varied geographies and varied, social and other determinants as well. And as you know, collaborative action is one of the very, very beautiful system approach for, addressing these challenges. So what do you think, like how these collaborative efforts can address these complex issues, especially when we consider the women and the context of the children as well?
If we are talking about collaborative actions for transforming women's health, that's a very good point that you raised, that collaborative actions to what end? And if these are to address challenges, let's also quickly look at some of the challenges that you mentioned. We have challenges because of the socio-cultural context, the socio-economic status of families, and within families, especially of the women, the agency of women themselves could be due to socio-cultural reasons, whether they have equal rights to be able to take decisions for their own health. And that is when we are talking for the country population at large, and not just the urban areas and women who have better education than those who do not. And then women have specific challenges which are around their reproductive health, and sometimes also related to reproductive rights, if they are not able to make informed decisions and choices themselves. And then, of course, with childbearing, we also know the mental health issues. And sometimes it could, the mental health issues could also be related to reproductive rights. Let's say if a woman is having difficulty in bearing a child, or for that matter, is not wanting to bear a child. So that can also lead to a lot of mental health issues. So there are these challenges. And I think women, we all agree and understand that it's not just a moral imperative to transform women's health, but it's also important for societal development, because they are the bedrock for the family's well-being and also societal well-being. So if these are the challenges, then collaborative actions targeted towards each of these challenges is what is important. And what is also important is to understand who all should collaborate towards these goals of addressing these specific challenges. And we could discuss that in detail if...
I'm sure that various stakeholders are involved when we're talking of collaborations. especially when you're talking of providers, we are talking of the policymakers, we are talking of researchers. The community itself has to collaborate, isn't it? These are the stakeholders. And definitely, I think the voices of women themselves have to be taken into consideration when you're talking of a collaborative action. So what do you think the role of each of these stakeholders, and especially the voices of women, how all those stakeholders can be built in and can be, brought in when you are talking of a collaborative approach?
Okay, so let me pick 2 or 3 examples if we have to discuss collaborative action and towards what end, that is to address specific challenges. First example I would want to pick up is the first, so to say, women physicians in India. And let's refer to the lives of Dr. Anandi Gopal Joshi, who was in fact also from Maharashtra, as you are, from Kalyan in Maharashtra, and Dr. Kadambari Ganguly, if I remember correctly. And I read that both graduated at the same time in 19th century. And Dr. Joshi was married at the age of 9, had her first child at the age of 14. And all of this motivated her to find solutions and also try to address women's health, that other women like her should not suffer. And the result was that she ended up in the US to study medicine, came back successfully with a medicine degree, and she started practicing. Unfortunately, we lost her at the age of 22. Similarly, Dr. Ganguly, who was from an upper caste Brahmin family, and we know the socio-cultural context from that time. And she also, because of similar reasons, wanted to study medicine. And then she also ended up being the first Indian medical graduate in modern medicine from Calcutta Medical College. Now, who all collaborated here? It was the family, the society, and especially the husbands, the partners, who stood by these ladies to help them achieve these goals. So, these collaborative actions begin at very small level, as you mentioned, in communities, in families, and people around women, if we have to strengthen the agency of women themselves. Then let's take another example. The challenge around mental health. So we know globally 1 in 10 women experience some kind of perinatal mental health issues. And now studies are showing that in India, this could be 14 to 24%, the perinatal mental health issues. So I'm aware of a collaboration between the National Institute of Mental Health and Neurosciences, NIMHANS, the Royal College of Obstetrics and Gynecology, Fogsi itself, a lot of self-help groups in the program areas where this collaborative action to address perinatal mental health issues for women started. And with these self-help groups also came in the frontline health workers. And then through this collaboration, I was told that about 2,000 Fogsi members and 5,000 frontline functionaries were trained, which led to self-help groups and frontline functionaries identifying women who were at risk for perinatal mental health issues during the antenatal care checkups. And in fact, these experiences are now informing scale-up of perinatal mental health issues in the antenatal care program across the country and many states. So there are these different stakeholder groups. And the last example I would want to pick up is, let's say at a national or a global level, what are the key stakeholder groups that could come together? So when we were moving from the MDG to the SDG era, and when from the MDGs, 17 SDGs were formulated to measure our progress towards 2030, the global goals. The 17th SDG, which was added, was around partnerships. And the SDG Knowledge Hub said that instead of the transactional public-private partnership approach, now we should look at partnerships with engagement of 4 specific stakeholder groups. And easy to remember is A, B, C, D as groups. So A is administration, which is responsible for policy making and taking things to scale for its entire population. Administration means the governments. Then B is businesses. Businesses coming in with resources through their corporate social responsibility, through their assets, through their employees. C is the most important, is the civil society and the community itself. So self-help groups, women's themselves, communities, families. And their role is to ensure that A and B are accountable for C, which is the population they are serving. And then there is the specific group, which is easy to remember, is the D, development partners like the UN, UNICEF and WHO, that are not true civil society, but they're actually multilateral organizations that exist in countries to work with which is the administration, the governments, to ensure that global policies, guidance, and good practices are also moving from one country to other, and people are learning from each other. So when we are looking collaborative actions at the national level, I think it's very important to understand the unique and specific role of these 4 stakeholder groups: the governments, the businesses, the civil society and community, and the development partners.
Absolutely. I think for me, the 2 takeaways which I got is that initially the family and the communities. When we are talking of women empowerment also, when you're talking of women, advancing, progressing, we do need that partnership with the family itself. You have your partner, the male partner is so important. I mean, we cannot talk of empowerment in women and, only take women's groups together. We have to have the community together. And the second one I thought, which was very important, you highlighted, was the various organizations like the UNAID or the WHO and the government of the country and the civil, the policy making whole system, isn't it? These 2, I think that these are development, the agencies which are coming together when you're talking of collaboration. So I think these are the 2 collaborations which can be very well highlighted and have taken the transformation in the women's health. I think these are the 2 stakeholders which you are really talking of. So do you have, you are in the UNICEF and you have been in various organizations like WHO also you have worked with. So as a researcher also you have worked with. So can you highlight some initiatives like you talked of the perinatal mental health, other initiatives, if you would like to highlight certain stories or the success stories from your side?
Okay, let me pick one very unique story. And this is regarding some of the emerging women's health issues. Let's say women have a lot of hidden risk for non-communicable diseases. When it comes to heart health, for example, we often think of men. But most undetected cardiovascular conditions are in women, in fact, because we take women's health for non-communicable diseases many a times for granted. And then similarly, the highest burden of cancers, like cervical cancer, which at least has a vaccine, or breast cancer. These issues often, if we do not have agency of women high, they might suffer because of these issues. And then, of course, the reproductive health and the ability to make choices here. So, for example, we know that there are many states in the country, in India, where early marriage is a big issue. And in fact, Government of India, led by the Union WCD Minister, has been launching these campaigns, trying to reach out to communities through multiple stakeholders to try to reduce this. So I would pick one collaborative action through an agency called Engender Health. And UNICEF was working with this agency, Engender Health, which also works closely with many governments in the country on some of the women's health issues. So we decided in the state of Bihar to pick young girls and boys, mainly girls, but then we realized that we also need to pick boys, and we helped these girls and boys to adopt one family each, where there was a woman of reproductive age group, either in pregnancy or had recently given birth to a child. And the objective of this program was that each young person, these girls, the women, young women or men, boys, they were given the responsibility of ensuring health of the woman of the family and of the family through her. And during this process, there was a hidden, subtle objective we were trying to observe, that let's say if these were families that had recently given birth to a child, so were these young champions, were they able to ensure that there is no discrimination between a girl child and a boy child? And how did they act differently when they were working with these families to ensure health of the woman and through the women, the health of the families? And it yielded very good results. So, when we tried to compare these families with other families vis-a-vis how they were bringing up their children, whether it was a girl child or a boy child, we thought that when these women from communities, young champions, they were able to come together with the frontline health workers like the Ashas, ANMs, Anganwadi workers, and then they were able to work with these families, inform them about some of the government schemes. Many a times families are not even aware of what are the women's health schemes that are available. For example, let's say the benefits through various schemes. India has a program which guarantees services to pregnant women, and it says zero tolerance for denial of services. It's called Suman, Surakshit, Matratva, and everything emerging from it, including the newborn's health. So this was a collaborative action where, we tried to increase the agency of young girls to help them champion the health of women and through the women's health of the families.
That's really wonderful. And I remember when I was in medical school, and even now when I was in faculty in it's Sevagram Medical College, Mahatma Gandhi Institute of Medical Sciences, we used to, we used to train the medical students by allowing them to adopt the whole family. You must have heard about this, initiative of the medical student adopting a family from a village and then trying to find out what are the various issues each one of these members they would treat as their own family members. And then
that's a very important point that you mentioned. In fact, now National Medical Commission has made this compulsory for all medical schools, and this is part of the curriculum. And it emerged from Sevagram. I remember I used to give example of Sevagram, but now it has become part of the National Medical Commission's curriculum for all medical colleges. And we know the pace at which medical colleges are increasing in India. And as a country, India is trying to increase its health workforce to ensure universal health coverage. So this is a very important point, that through this engagement, Fogsi runs so many women's health-centered programs which are having transformative potential. So I think it's a good idea that even Fogsi should try connecting to the medical student fraternity and see how they can help them adopt these families and also learn more about women's health issues. The research in women's health issues is catching pace, but we all know globally there has been a disparity in the men's issues being researched and women's issues being researched. So this is a good opportunity.
Yeah.
for
And when
Foxy.
you talk of Foxy, and I remember as a collaboration with UNICEF, when you're talking of big organizations like Foxy, more than 40,000 members who are OBGYNs, they are having such a lot of, reach in the community. And I remember the way the Foxy and UNICEF partnership has worked for creating awareness about HPV vaccine. Recently, if you look at the type of work being done in the collaboration, so here we are talking of, adapting families is one way, and another is scaling up a huge awareness event or the awareness program with, member bodies which are having huge memberships. What do you think? Like you have the IAP, you have the Foxy. So any sort of a collaborative effort you remember as which can be, not only informative, but it could be a sort of a inspiration.
I think the topic for today's conversation is really very important. We know how health is compartmentalized and getting more compartmentalized indeed. And that is where the professional associations like Foxy and Indian Academy of Pediatrics and others can make some transformative change and come together. For example, UNICEF exists in countries because of the conventions of the rights of the child, which gives many rights to children up to the age of 18 years as it is defined. In the Convention of the Rights of the Child, the most widely ratified legal document globally, families is mentioned 19 times. There are 54 articles in this rights convention. Families is mentioned 19 times. And we know that women are central to families' health, growth, and prosperity, and also for the nation's development because of that. And one example I would take is that when COVID happened, Foxy, IAP, National Neonatology Forum, and a few other professional agencies, associations of the nursing groups, they came together, and through the great process, the guidelines around sick newborn management and pregnancy and for all interventions around the time of birth, both in the maternal and newborn side, many guidances that emerged from India were judged the best through the great process. So very high quality with speed, but also collaborative actions of these agencies. And I think that is what is required today. So, for example, some remarkable reduction in the newborn mortality space is happening because the Federation of Obstetricians and Gynecology and the Academy of Pediatrics, the neonatologists, they are coming together to ensure continuum of care from pregnancy to childbirth and beyond. And I think this should get strengthened further. I know that Foxy has 250 plus. You are a federation of societies. So even I would say collaboration first within these societies across states. For example, India, 8 or 9 states have already achieved the SDGs. The range of maternal mortality is from 300 plus to about 100 and less than 100 now in the next week's release. So how can these societies of the Foxy from different states, these 8 states that have already achieved SDGs, how can they inform those states that are at the cusp, about to achieve, or are lagging behind and need a lot of support? So these kind of collaboration, then collaborations across professional associations and across sectors. So I think there are multiple ways these collaborative actions can impact women's health.
Absolutely. I think we cannot work in silos. That is not going to, take us anywhere. And I think this is a great idea when you're talking of, Foxy having 280 societies and in various states. Some of the states are doing really good. They are, Kerala, all the southern states, Maharashtra, if you're talking of, they are doing really good. Some of the states have to catch up. So we can share our knowledge, our processes, our skills. We can exchange our ideas. It's a really good collaboration. You are talking of within the organization. And of course, when you're talking of the Pediatric Association, the Gynec Association, the Perinatal Mental Health, the Psychiatrist. So really, I think we can build up huge studies, interventions, researchers. So I think it's a very wonderful idea. Through this podcast, even I, as a clinical research committee chairperson, I'm getting these ideas of those interventional, projects. And you, I think, being in the Lancet as a regional editor, do you think enough research exists for this collaborative action, or we need to do more? What is your, personal experience about this as far as research is concerned?
So, as I mentioned early, that there has been global disparity within the research of issues that affect men's health versus women's health. But if we talk of India per se, the scenario for research for women's health issues is improving drastically. And in fact, at the helm of India's medical research, which is called the Department of Health Research, now, incidentally, the Secretary, Department of Health Research and Director General ICMR was heading the research for maternal and child health for the WHO in Geneva, and was a secondee from India's own National Institute of Repute, the All India Institute of Medical Sciences at Delhi. So why I'm giving this example is this didn't happen by chance. This was a definitely thought through choice by the country that there is importance of improving medical research. And that has also led to drastic improvement in issues around women's research. A lot of implementation research is happening. Issues around uptake of, let's say, you talked about the cervical cancer. So uptake of vaccines and what it takes in communities and families to focus on the women's health issues. And what would it take, to quickly ensure that women get such interventions like the HPV vaccine to improve their health. So I think the future looks very promising. Professional associations should reach out to the Indian Council of Medical Research. It has a great network of institutions across the country to see how public and private, there are many individuals and institutions that have a lot of good quality research happening, which are outside of the public sector realm. So are they coming together? I think professional associations like Fogsi can bring that together. So for example, in one of your 280 societies, you yourself have been a researcher, or for that matter, the current Fogsi president the other day when you were introducing her illustrious career on the artificial reproductive technologies and others. So what you can do as a federation is, are the individual researchers, institutional researchers in private sector coming together with the private public sector research priorities? Are they networking with other institutions? Because in research, it is very important to have a situational, good quality situation analysis for framing your research. And is it going to lead to some societal change? And also, do you have the understanding of how would you translate your research? So you may be doing an excellent research, but let's say it never gets translated for actions on the ground, policies and benefits to reach the society. I think the federation and such professional associations can play a role in each of these steps to ensure, first, we have adequate research in trying to address the challenges facing women's health. Second, ensure networking and collaborative actions across individuals, agencies to ensure that good quality research is happening. And the third critical step, whether there is adequate ecosystem for translation of the research so that benefits can reach the communities as fast as possible.
And I think I am very happy to share that from the Clinical Research Committee chairperson side, we have this kind of, collaborative research in the optimizing C-section project, which we are doing. So we have 50 centers, 50 healthcare facilities from various states, from various geographies. It could be a public, it could be a public big institutes like AIMS, PGI Chandigarh, and all the medical colleges, and we have private sector medical college institutes, district hospitals. So all of them, and like you said, something has to happen in transformation. It's your research has to show that outcome, isn't it? So if you're saying optimizing cesarean section and you're doing research, so your outcome has to be that you are really doing something to either reduce, or we use the word optimize, because it's not only about reduction. Wherever the C-section is needed, it has to be, provided. So I think that I would like to share the kind of work Fogsi is doing, and we would be taking it worldwide now with the Southeast Asian region, the Asia Pacific region. So I think these are very good collaborations which Fogsi is trying to do. And I think we are coming at the end of our discussion. And I would like to know from you, what is the future? How do you think you can envision a collaboration, to transform exactly what are the vision for your future or take home for the audiences?
So I think it's a no-brainer that we all should ensure investing in women's health as a priority. As development agencies in the UN, all our work has to have two guiding principles, which is the equity, and within equity, focus gender as a equity marker. And that is obviously for the reason that investing in women's health are the most important levers, not just for the economic growth, but for societal development. If we have women who have their agency to make choices for their health, to have the knowledge and the tools for their health issues and how they can manage that, then we will get healthier families and sustained economic development. And of course, that's the reason that we all should work for transforming women's health through collaborative actions every day, one step at a time.
I think that's a really good, transformation, message which you have given to all of us. And this whole discourse have given us new ideas how we can go ahead. So as we conclude, Doctor, this insightful episode of Gyan Pravah, I extend my heartfelt gratitude to you, Dr. Vivek Singh, for your expertise, for shedding light on the critical need for collaborative action in transforming women's health. Your dedication to improving maternal and child care is truly inspiring. Thank you so very much. And a special thanks I should give to Dr. Sunita Tandulwadkar, our Fogsi president, whose visionary leadership has made this platform a reality, transforming discussions into action and fostering meaningful change in women's healthcare. To our audience, thank you for tuning in and being part of this journey. Your engagement and commitment to advancing maternal health drives us forward. Stay connected for more thought-provoking discussions in the upcoming episodes of Gyan Pravah. Until next time, let's continue to learn, share, and empower. Good evening and take care.
Thank you, Professor Surekha. It was a pleasure speaking to you.
Thank you. I would like to sign off for today. Bye and have a good evening.